a brain attack that occurs when a blood clot blocks an artery, a blood vessel that carries blood from the heart to the body, or a blood vessel, a tube through which the blood moves through the body, breaks, interrupting blood flow to an area of the brain. When either of these things happen, brain cells begin to die and brain damage occurs. When brain cells die during a stroke, abilities controlled by that area of the brain are lost. These abilities include speech, movement, and memory. Uh, a stroke patient is affected, or how he is affected depends on where the stroke occurs in the brain and how much of the brain is damaged. For example, someone who has a small stroke may experience only minor problems such as weakness of an arm or leg. People who have larger strokes may be paralyzed on one side or lose their ability to speak. Some people recover completely from strokes, but more than two-thirds of survivors will have some type of disability.
Usually, the person will have trouble with walking, trouble with speech, trouble with processing information, balance will be a little off just because of the lack of blood. It's like being lightheaded, like almost like dehydrated, more intoxicated. And then also like trouble with seeing out of both eyes and like severe like headaches, like migraines. These are all like ways to spot out a stroke, which is hard because these are some common things that you can go through. Like, oh, I didn't drink enough water the past week, so I got a headache. Or like, oh, dude, we totally, got trash last night, so I got a headache. Yeah.
There are several ways to prevent having a stroke. Make sure you know your blood pressure and make sure you stop smoking and control your alcohol use. And make sure you watch your diabetes and take Honey Nut Cheerios to lower your cholesterol. And also treat circulation problems. And transcendent attack, a TIA. Want to watch out for that.
All right, this is causes of a stroke, which kind of goes along with what is a stroke. But if blood flow is stopped for longer than a few seconds, the brain cannot get blood and oxygen. Brain cells can die, causing permanent damage. There are two major types of stroke: ischemic and hemorrhagic stroke. Ischemic stroke occurs when a blood vessel that supplies blood to the brain is blocked by a blood clot. This may happen in two ways. A clot may form in an artery that is already very narrow. This is called a thrombotic stroke. And then a clot may break off from another place in the blood vessel of the brain or from some other part of the body and travel up to the brain. This is called a cerebral embolism or an embolic stroke. Ischemic strokes may be caused by clogged arteries, fat, cholesterol, and other substances collect on the artery walls, forming a sticky substance called plaque. A hemorrhagic stroke occurs when a blood vessel in part of the brain becomes weak and bursts open, causing blood to leak into the brain. Some people have defects in the blood vessels of the brain that may make this more likely. Okay, so basically what causes these things, though, is more like unhealthy eating, bad dietary habits, just not being very active, having a lot of fat.
Gotta stay on them Cheerios. Gotta stay on them Cheerios.
And which causes just blood clots and stuff to build up on your artery walls.